With the help of impression tray, you take a putty impression. Then you remove the putty wax rim from the impression tray and prepare it to the exact vertical dimension. If you see the inner surface of the putty wax rim, there are 3 impression pores. So exactly how it is fitting in the patient's mouth, it is exactly going to fit in your final cast. So laboratory won't create any error in your transferring your record. You mark the midline, you mark the high smile line, low smile line. Once you are satisfied with everything, you prepare on the occlusal surface, you prepare a nix and notch on the occlusal surface, and you flow the bite registration paste and guide the patient into the centric. This will give a very good indentation of the lower teeth. So there is no chance that laboratory will do any error in mounting of this jaw relation. So this is a very predictable method of taking a jaw relation and transferring to the lab how you record in the patient's mouth. Now, since in this case we have gone ahead, this is the final post-operative OPG of a patient. Now, since in this case we've gone ahead with the metal composite restoration, we asked the patient to wait. We immediately mounted the final cast on the articulator and we started with the teeth setting arrangement. Excuse me, my screen is freezed. Yeah. So to do the teeth setting arrangement, all the impression posts were splinted with the patent resin and the teeth setting were done. Once the teeth setting trial is taken in the patient's mouth and approved by the patient, this will go ahead to the laboratory for the fabrication of the metal framework. Now the lab will take a putty index of the teeth setting. Since the composite teeth are a shell-like teeth, so in a metal framework, each stud should come out to support the teeth. Apart from this, you can also use some beads or notches for the extra retention of the prosthesis. Here we have used the beads. Once the metal trial is taken in the patient's mouth, then it will go for the final prosthesis fabrication. So this is the final metal composite restoration for the patient. And this we have cemented in a patient's mouth. Since you can see there is a gap in the lower prosthesis, which is done in 1 year back, I will show you how easily it can be relined when we have used a multi-unit implant in the later part of my presentation when we go ahead with the multi-unit implant. This is a final post-operative picture of a OPG, post-operative picture of patient, and this is final post-operative after the relining of lower prosthesis. Another thing I wanted to tell you about the mill metal framework. In case of normal strategic implants or a multi-unit implant, it is possible to go ahead with the mill framework. So to see one case, this is an intraoral picture of a patient. This is intraoral preoperative OPG of a patient. Flapless placement of a strategic implants without any cut. There is hardly any bleeding, and this is the final implant placement. All the impression posts were placed on the implants and they were splinted, and the final impression was taken with light body and putty. This is a final post-operative OPG of a patient. If you can see a shadow of a putty wax rim on the OPG, so whenever you are doing the upper and lower arch together, if patient feels uncomfortable or if you want to avoid biting of the patients on the implant, you can give a putty wax rim to the patient as a guard. Now to go ahead with the mill framework, all the scan bodies are available, whether they are on the normal implants or they are with the multi-unit implant. So you can use the scan body, and on the exocad you can design the mill framework. I always recommend to ask your lab to give you a jig trial, whether you are going with the casted framework or you are going ahead with a mill framework. So whatever amount of reduction the laboratory has